Hey guys, my name is Madison Nye, and today I'm going to be doing the head case study. So let's first begin with our patient background. Our patient is a 32-year-old male who came into the emergency room after a camping vacation, complaining of a 3-day fever, chills, and severe headaches. He reported that 6 days ago he had a boil on his upper lip, which resulted from a cut from shaving at the campsite that became increasingly enlarged and irritated as he touched it.
Upon physical examination, our patient was ill-looking and restless. His temperature was 102.8. His neck muscles were rigid. His upper lip was hard and swollen and red, twice its normal size, and it was a bit crusty on his lip, and the part on his lip right here was oozing. I apologize if you're eating. His upper and lower eyelids were both swollen, and his left eyeball showed signs of dilation of the pupil and chemosis, which is fluid in the eye. The fundoscopic examination shows engorgement of the retinal veins and edema of the optic nerve at the pupilla. All voluntary movement of his left muscles were absent. Hardening along the course of his left facial vein is noted as well. The right eyelid was mildly swollen, and his right eyeball was protruding slightly, and the patient could not fully abduct the right eye. An MRI and CT scans of the head were ordered. So let's see what those look like.
So looking at our normal MRI result, which is on my left, I don't know if it'll be on your left or not, but the one that says normal, we can see compared to our patient that the normal one, well, our patient is a lot more enlarged. There's a lot of pressure going on over here. So his internal carotid arteries are enlarged with the left cavernous sinus, and the extraocular muscles are also enlarged, as well as his non-enhancing left superior epithelic vein compared to the right one. Other tests shows that his blood cultures are positive for Staphylococcus aureus, which is a bacterial infection, and his blood count revealed a white blood count with 92.8% neutrophils.
So let's take a look at the extraocular muscles and see where their actions and innervations come from. So there are 6 intrinsic eye muscles, and we're going to start with one, which is the inferior oblique, which is cranial nerve number 3, and it elevates and turns the eye laterally. Number 2 is the inferior rectus, which is also cranial nerve number 3, which pulls the eye inferiorly. 3, the superior rectus, is also cranial nerve number 3, and it pulls the eye superiorly. The 4th, medial rectus, is also cranial nerve number 3, and it pulls the eye medially. The lateral rectus, which is cranial nerve number 6, pulls eyes laterally. And the number 6, the superior oblique, is cranial nerve number 4, which depresses and turns the eye laterally. So I'm guessing you're wondering how we test the extraocular muscle functions. And let me tell you, I think we've all done this before, whether we've noticed it or not during our eye exams. So there are 3 variants of the test. I have a picture here of number 1, which is where you would be, someone would be across from you and moving their finger, and they would have you follow their finger with your eyes without moving your head. 2 is the cover-uncover test. So I would be looking at something across the room and be covering my eye and then uncovering it, and the reaction of that covered eye would tell us something. Also, number 3 is the alternative cover test, which you could probably guess is I'm looking at something across the room with one eye covered and then the other eye, and it just alternates. Let's have a look here at the facial veins with our beautiful model here that looks kind of like Jackie from that 70s show. the facial veins and passageways. So the facial veins are the blue, and you can see here that it goes around the mouth and over up around the eyes. And honestly, I would say that the patient had blood flow through the labial arteries around the mouth. That's where his boil was. So, moving on. This guy was much like David Bowie and had pressure coming down on him. So we're going to take a look at the cavernous sinus locations and the surrounding anatomical structures. So if you look below at the guy with the X on his face, that's the cavernous structure. The cavernous sinuses are located within the middle cranial fossa and on either side of the sella tunica of the sphenoid flume. You see there's a little X. So the anatomical locations, there's the roof, the medial border, the sphenoid sinus, the floor, and the lateral border. As for the nervous system, we have the ocular motor nerve, which is innervated by cranial nerve number 3, I believe. Then we have the trochlear nerve, which is cranial nerve number 4. The ophthalmic nerve is cranial nerve number 6. I believe it's a really tiny picture. The maxillary nerve looks like cranial nerve number 5. And the abducens nerve is cranial nerve number 6 as well. So as for the cardiovascular systems, because this is all related, we have all of these veins. But if you could look at the cavernous sinus, you see that it's basically in the middle of everything. So this guy, if it gets in his bloodstream, it's gonna go pretty quickly. It's going to travel pretty quickly, which leads us to the prognosis and the diagnosis. So how the heck did this happen? So our patient was on a camping trip and he was shaving. As we all know, camping trips can be a bit primitive and hygiene can kind of go down during this time. So our patient tested positive for Staphylococcus aureus, which is a bacterial infection that happens when you're lacking a bit of hygiene sometimes. So this most likely started with the nick on his face when he was shaving. Unfortunately, I do believe that this patient has a blood infection due to the staph spreading, the Staphylococcus aureus spreading. His vision trouble, which is the edema that he was experiencing, has happened due to the spread of this infection. So what the heck are we going to do about it? Well, thankfully our patient came in and just in the nick of time. But anyways, he came in the nick of time, so we were able to give him antibiotics, which is penicillin for this particular Staphylococcus. We told him to be a bit more careful because if this was left untreated, it could have led to sepsis because it was in his bloodstream. With that, we also told him to take better care when it comes to hygiene, wash his hands more often, next time he's out on a camping trip, make sure to maybe not even shave, YOLO. So, yeah, I do believe our patient will be doing well once he has his antibiotic treatments, and he was very lucky. So, thank you so much for watching this video. Here are my references, and wash your hands, even if you're camping. Thank you.